Hello everyone, thank you very much for your patience. Thank you for joining us at this training webinar for the dental e-portfolio, the new e-portfolio that Health Education England, Health Education and Improvement Wales and the Northern Ireland Medical and Dental Training Association have been working together on to launch for September 2020 for the new training year for Dental Foundation Core and a variety of other dental training programs. Thank you very much for joining us. The webinar is being recorded and we will make the recording available to all of you who have attended and to anyone who's not been able to attend as well. So don't worry, the webinar will be made available and the slides that we'll be showing will be available as well. So just a quick rundown of what the next hour or so is going to look like. I'm going to very quickly do some introductions and give you a few of the house rules, and then we'll move on to the e-portfolio walkthrough and training part of the session, which will form the main part of the session. We will have breaks for question and answers during the training, and we will also have some time for questions at the end. So my name is Kata Varnai. I'm the ePortfolio's project manager for Health Education England, and I'm the project lead for the new dental training ePortfolio. And joining me today is Peter Cranfield, who's the Regional Advisor and Training Programme Director for Health Education England in the Midlands and East. And Peter is the technical lead for the new ePortfolio project. So as I've said, the webinar will be recorded and you'll all have access to it shortly. We will also be producing and providing written training materials later on this month and in September, and there'll be training materials aimed at various different user types, including dentists, trainee dentists themselves. So during this event, we've got a live Q&A. I think some of you have already found that. Please use that throughout the session. The questions will be moderated and published as appropriate. So when you post a question, you won't see it come up in the main question box straight away. We will moderate those questions and publish those ones that we will be able to answer during the webinar. Please make your questions very much focused towards the functionality of the ePortfolio. Any other types of questions we won't be able to answer during this webinar. Lots of these questions, please, is more appropriate if you direct them to your local leads, and I will let you know in the sort of private version of the chat if I think that's the case for your question. We've got about an hour for the webinar, so I'm going to make sure that we really only focus on the questions that are about the functionality of the ePortfolio. Note that there's a slight time delay between when you send your question and when we see it, and a slight time delay between when you hear us and when we've actually said what we've said, so just bear with that. We will break periodically for questions and we'll address all relevant questions during these designated breaks, so don't worry, it's not that you're being ignored, we just want to get through some of the material and then we'll deal with some of the questions. So without further ado, I'm going to hand over to Peter for the main part of the webinar. Peter, over to you.
Thank you, Kata. Well, welcome everybody. Thank you for coming along to this webinar. This is the second webinar we've had today. We've dealt with Dental Foundation training earlier today. It's Dental Core training now, and this is aimed at educational supervisors and training program directors. So hopefully we'll be able to answer a lot of your questions and provide you with quite a lot of information. Now, there we are. As Kata said, there's quite a delay between us saying things and you hearing what we're saying. So please, if you do have questions, write them as early as you can so that we do know what is happening. We will try and answer all the questions. We'll try and run through the portfolio as much as possible and try and explain how it works. So let's just try and get things ready. Sorry, I'm just trying to present things properly. There we are. Okay, right, there we are. So now you should be able to see the presentation, and a little bit of a PowerPoint presentation to start with about things. E-portfolio, it is a dental e-portfolio because it covers dental foundation training, dental core training for all 3 years, performance list validation by experience, and dental therapist foundation training. It's all in one platform, and all of the portfolios have a similar feel because they are different, because dental foundation training is covered a DFT curriculum which is quite specific and it emulates the current e-portfolio. But it links with the DCT portfolio, so that's a plus point that we can do by having the portfolios joined together. PLVE, again, that's quite specific, and this is new. They've never had a PLVE portfolio before, so this is for PLVE people, and hopefully they might be going to do DCT, so this will be useful experience for them. And of course, the other flavour is dental therapist foundation training. Again, they've never had a portfolio before, but there are several pilot schemes running around the country, and they're going to be able to use this. Dental core training. Now, the layout is similar to the dental foundation training e-portfolio. We've done that for a reason. A, because it means there's some degree of continuity, but it makes it much easier to share tools, educational tools, between all the portfolios. We've used most of the educational tools as per the current TURAS portfolio, but we've also brought in some additional tools from some of the other programs, and we'll show those to you, and we hope that you'll think they're really quite useful and extend the usefulness of this educational tool, because this is what it is. It's there for education, to help people. It's not just a task to be done. It really is supposed to be educationally helpful. And we hope you'll find this format of portfolio has got really, really great flexibility. So let's move on. Sorry, I'm just trying to sort this out. There we are. So our picture's disappeared now. It's probably a lot better. So we've enhanced quite a lot of items in the portfolios. Reflections we've enhanced. Learning and development needs. There's something we've brought in from DFT. This is new for dental core training. We've got a patient satisfaction questionnaire, multi-source feedback. Dental foundation training has a professionalism, leadership and management area. It's a curriculum log, significant events log. This is totally new for the dental core training, and a complaints log, which is new for everybody. And in the dental foundation training, we've got a clinical experience log and a complex treatment log. New items, personal development plan. This is very different from the current one in the TURAS portfolio. CPD log we've built in, and there is, or there will be, a checklist of things which have been completed for FRCP. We've also got a confidential notes section built in for educational supervisors and training program directors. Now, the pandemic, COVID-19 pandemic, has meant that at the last minute we've had to add quite a lot of extra things. We've now got simulation reports and got placement reports for dental foundation training, a remote KEX for dental core training, clinical categories for dental foundation training, and generic DOPS for dental foundation training. So we've had to add various other things. The portfolio does begin on the 1st of September 2020. We are on time to do that. Names of trainees and educational supervisors are set up by the regional administrators. They'll be able to upload names directly into the portfolio, and this will, we hope, reduce a lot of bottlenecks. Login details for you as ESs and TPDs will be sent to you as early as we can. It will depend upon your regional administrators. and your GDC number will be your username. That's quite an important thing to remember, because that is the key to everything. Even as we speak, Axia, the company who built the portfolio, are setting up all the administrators and TPD logins, and you might already have received an email today if you are a TPD or associate dean, to give you a login. And development is still in progress. We're almost there with everything. Most of it is working, but still some things are changing, and they will continue to change as we get feedback from people. Now, what I'm proposing to do is to have a short overview of the actual portfolio, and then we'll go back to the PowerPoint and explain some of the new areas, how they work. So, are there any questions at this stage at all, Kata?
No, nothing yet, Peter.
Okay, fine. Okay, well, let's move on then to the portfolio itself. Now, the login is a fairly straightforward login, but it's got a second area here, register a team member account. And this is so that a team member for the patient satisfaction questionnaire can set up an account. I'll explain this in greater detail when we go into the detail of the PSQ. But it does mean that we can then get people in your clinic or on your reception desk able to log in and provide the patient satisfaction questionnaire for your patients. So log in, and what I'm going to log in is as an educational supervisor to start with. And this is a test account, and this educational supervisor, Elise Kirk, is really quite a talented person because she's got a whole load of trainees that she's looking after. But I've got a trainee here, Susan White, who is in dental core training. If you are a supervisor of more than one person, you'll have these logins available, and you'll see pictures of the people, and you can see here they really do work. So we'll log on to the core training e-portfolio, and this is the dashboard. This is what you'll see. Now, this is basically been set up fresh. This is what you'll see for your trainees when they start in September. Things are laid out in a similar fashion to the Dental Foundation training portfolio with the dashboard and various tools set out in blocks. We've got an induction area here. You've got supervised learning events here. Portfolio documentation here, quality improvements, achievements, personal development plans. Feedback here. And logs here. We've got a report here, curriculum log report, and we've got IRCP reports and FRCP reports. So things which are new, what do we put in which is new? We've put in an induction checklist, and this is something which the trainees will start. If you log in as an educational supervisor, you'll see what your trainee is going to be ticking. They've been given these things to check, and hopefully they will be able to tick all that and pass that on to you, so that then when you go into the educational supervisor induction meeting, you can add a new induction meeting and you'll be able to look at things there. So that's fairly similar to the TURAS one, except for the inclusion of an induction checklist. The supervised learning events, they work in a similar fashion, but you'll see that we've added here an extra remote PECs, and we've got direct observation of procedural skills under simulated conditions. Up here we've got the personal development plan and other interesting areas like that. What I'm going to do now is log out from here, and I'm going back into the PowerPoint presentation to tell you a little bit about the details. Now, the login, as I mentioned, is a normal login, and there's the registered team user. It says practice user, we changed the name of it, it's team user. They enter an email address, then a password, and they get guidance on the password. And again, if you have to change your password, as you will do possibly at the start, you get good guidance on what to put in there, and tells you when you're getting the right things. When you first log in, you will see an agreement like this, which you have to tick and agree to. I don't think there's anything contentious there, but it just means that you have agreed to data collection aspects of the portfolio. And then probably this is what you're going to see when you first log in, because you haven't got any trainees assigned to you. The way the portfolio has been built is that the portfolio belongs to the trainee, and educational supervisors and training program directors are allocated and linked to the trainee. As soon as you are linked to a trainee, the trainees aren't linked to you, you are linked to them, then you will be able to see their e-portfolio. In the e-portfolio, there's personal details. You can edit your profile, there's messaging, there's notes, and a logout. Profile, it's worth going in there and checking that. Some things you will not be able to alter. If your name and username are wrong, you have to go to your local administrator to be able to change that. But you can alter your email address and your contact number. And it's worth putting a profile picture in because it helps everybody within the e-portfolio. Now, the notes function is something we've introduced, and this is something which you as ES or you as training program director can use. You've got the ability to write totally confidential notes which nobody else can see. So if you've had a difficult conversation or an important conversation, you can write a contemporaneous note, and nobody else will see that. You might wish to use that information later in a report or in a reflection or something like that. But you have that there as evidence, and if things are going wrong, then you might well wish to use that. We think that's a very important new function that we've built in. Now, workflow, we've copied this from the old Dental Foundation training portfolio, this ability to see where things are going. A lot of the tools have got a send forward or send back button, and you can see here the people who are doing things. This says FD. Hopefully in the DCT one, everything will say DCT. But it's green if somebody doesn't need to do something, and it's gone to the ES here, and it's yellow, something needs to be done, and it hasn't reached the TPD yet. Some items you can send back if it's not been completed sufficiently well. When we get to some of the lists, if there's a list of events, you can see there how things are, and you can see there the ES here has sent this back to the FD or to the trainee, and here the training program director has sent something back. There are view buttons so you can view the particular items, and some buttons, some forms got edit buttons if it's for you to edit, so you'll be able to edit that. Now the reflections, we've updated the reflections in all the portfolios, and we've now got identical reflections in each of the portfolios, and they align with those in the Medical Foundation portfolio. Again, the trainee, when they're completing it, they can either send it forward to you or they can save it at any stage as a draft. The prompts were put in, we think, are quite important and quite good. What the most important things that happened? Did anything go differently? What have you learned about yourself? And then next steps, how has this changed your perspective? What learning could you share with colleagues? Now, I believe that very often DCTs need help with reflections. Certainly our foundation dentists need it, and even at the end of the year, they're not wonderful at doing it. So they need help. it might be worth spending some time guiding your DCT through the events and consequences, and help them to highlight the successes, because this is something which people fail to do. They don't recognise their successes. They tend to focus on things which have gone wrong. I also believe there's no such thing as a bad reflection. There's some which can be enhanced, and I think you can send them back for enhancement, improvement. And again, don't forget about feelings. That can be an important part of reflection. What did you feel when that happened? Now, significant event reflection, this is totally new, really. In the old DFT portfolio, there was an ability to upload a significant event report. We've actually turned this into a proper reflection, so the trainee can note the outcome, and then give an account of the experience and reflect on it, analysis of the situation, and as I said, reflection, how do you feel, how does the team feel, how does the patient feel? I know certainly our FRCP panels in dental foundation training want to see significant events happen, but they want to see that there's been an understanding of what's gone on. They want to see consideration of the other people, some degree of empathy. There's also an ability to upload a report, so if there's a trust report which can go with that significant event, that can be uploaded. Don't forget the anonymity, and this is important. We've put a prompt in there about anonymity, and we've put some links there so you can get guidance about anonymity to help the trainees. It's an important part of writing portfolios in this day and age. Patient satisfaction questionnaire. Now, this is something new. I know some trusts have used these, some regions have used these, but this is totally paper-free. It's built into the portfolio. Patients are going to give their response via a tablet or a computer, or even could be a phone. And we need team members to organise the patients to give the response. So this might need some care and some thought in a trust situation, how this is going to be done. But the PSQ is set up by the dental core trainee and it's moderated by the educational supervisor. And we can do multiple PSQs. If there's change of post halfway through the year, they can do another PSQ when they get in their new post. First of all, the team member needs to register as a user, and this might be the receptionist, it might be one of the clinic nurses, could be anybody. DCT then goes into their portfolio and links that team member to their account. And then when the team member logs into their account, they'll see a PSQ and they can just pass that tablet to a patient. It does mean that probably some form of tablet or smart device is going to be needed. There might be a cost element here, but hey, you can buy a tablet for Amazon Fire tablet at Argos for less than £50. So it's not going to be difficult, I think. I can understand there might be some problems with internet in hospitals, but I'm sure these problems are not insurmountable. It's a chicken and egg situation, and we've decided we're going for this, and let's try and make it work. So let's look at it in proper stages. So the practice team members registers as a user. So I've got somebody here called Dara Darwin. She's registered herself with her email address. Now the foundation or DCT links the team members to their own ePortfolio account. So they log into their ePortfolio, they search for Dara Darwin, and then they add them. Then Dora is then linked. So Dora now, when she logs in, she'll be linked to this portfolio. In fact, when Dora logs in, she'll see on her a little tablet like that, and she can click on that and questionnaire becomes available on the tablet or the smartphone or the computer, and that can be passed to the patient for the patient to complete. When the patient's completed it, they can save it, and it's totally anonymous. Now, what happens then is when 20 questionnaires have been completed, the ES is then able to moderate and publish the report. So the ES will see a heat map, which represents the scoring, And we think this is a lovely way of presenting information. You see instantly that this trainee is doing well in these sorts of areas. These are questions, but in these questions, they're not doing so well. And then there are a whole load of comments down here, and the ES can moderate these. If there's something particularly toxic, the ES can say, no, we're not going to publish that. And they can just say no, and then they can publish it, press the publish button, there we are, publish report, and then it's visible like that to everybody, to the ES, to the DCT and to the TPD. And they can unpublish the report if some more questionnaires happen, or I can start another one. So we've got a degree of moderation there. And that's the finished report, how it's visible. Multi-source feedback. This again is paper-free, set up by the core trainee. They send email invitations, and there's an ability to resend them as well. And it's the TPD who moderates this. And again, multiple MSFs are possible, so you can do 2 or 3 in one post, or 2 or 3 a year, or whatever. The DCT initiates the MSF. So they say, let's start it, and then they have to do their own self-assessment, as they do with the TRS one at present. Now they can invite some colleagues, and they put the names in, and there's a list there of the people they're supposed to choose as certain parameters of 2 dentists more senior than the DCT, and they have to say what the category is there. And then when they've got enough colleagues, they can then press the button, and the invitations can be sent or resent. I just show you, see, got a button there, resend email, or they can add more colleagues. Multi-source feedback is publishable when 2 replies have been seen. Again, the TPD can moderate or does moderate this. And this is actually, this isn't the DCT report because it's something shorter in DCT, it's the DFT one. And you can see here how the heat map appears and all the published reports. Sorry, all the unpublished reports or published reports the training program director can choose to publish or not publish. There we are, they can unpublish, so they can start requests for further multi-source feedback. And they can see colleagues to whom report requests have been sent. Kata, do we have any questions yet, which I need to answer at this stage?
Hi, Peter. Yes, we do. So the first question is, can reflections be marked as private by the trainee?
No.
Okay, so this is something that was available in the previous system, in the TRS system, I think.
If it's
we're asking, how do they interact with that in that case?
Yes, it's not in any of the other portfolios either. If that's an issue, we might be able to change that, but it's, as I say, the whole point of the reflection is that it should be shared. Yes, but we haven't raised that. Yeah.
Okay, that's fine. There's sort of mixed feelings about it in the Q&A. So for this portfolio, this new portfolio, reflections, once submitted, are visible to the authorized people. Great. Next question then, can a GMC number be used as a username instead of the GDC?
Yes, it can be GDC or GMC number. In fact, the instructions given to administrators are to use GMC number if there isn't a GDC number. Yeah.
Great. Okay, next question. On TURAS, the ES's page and report looks significantly different to the trainees one. As such, information input from the trainees end looked different and was difficult to find on the ES's report page and easily missed on RCP. Is this now solved?
Well, I think so, because as we saw, I mean, I'll go back. Let's just log in again. I will log in. If I log in as the supervisor again, Let's find the DCT. Now this is the plan that you see. This is your view. And everything is laid out almost identically for the trainee. So let's log out and log in as the trainee. And everything is in exactly the same place. And you don't have to go hunting for things or clicking on tabs to find them. They are all literally there, accessible from the dashboard. And as you go through the particular tools, there's a breadcrumb trail, so you can go back to it. You can click on the programs at the top and go back to it. And here we are. See, the trainee can add a new quality improvement, and then when it's complete, they can just sign complete, and again they can upload files to that. There's also the curriculum links which they can use, and everything's there. The trainees don't have to go back and add the curriculum links later on. They can do it whilst they're doing things. So does that answer that question? I sincerely hope it does.
Thank you. Okay, so the next question is about MSF. In our region, trainees are asked to do 2 MSF a year. Juras could not accommodate this. Does this platform?
Yes, you can do 16 a year if you can fit them in. You can do as many as you like. It is limitless. Great.
Next question. When you send something forward in the workflow, does the TPD get an email or notification within the portfolio?
No, they don't. And we've had discussions with this with Axia about this. They're very loath to do that because people suddenly start getting too many. So there is no indication that's been sent forward. And it does rely on you logging in on a regular basis to see what is happening, and that presumably is part of the educational process, isn't it?
But then when you do log in as a TPD, you will see that there's a set of things on your list.
Yes, should we have a look at the TPD login, because the TPDs certainly have a different view from the ESs. So let's log in as a training program director. Training program directors will have a lot of people to look at. And this training program director is running no end of programs. There we are. So they've only got 1 dental core trainee, but they've got so the training program director will see everybody for whom they're responsible. They'll have a mini list of what they're getting up to. They can see here whether things need to be done. See here, there's nothing. This is all black. There's nothing they need to do. But as soon as something does need to be done, they can go in and do things. And this is in the form of a heat map. So you can see here that this young lady, Elaine Zavala, has done many more study day reflections than anybody else in her group. So as TPDs, you have quite a lot of things to help you there. And then when you log in there, you'll go to Elaine's page. And we have these markers here. We've got these black markers which say not started. We've got little clocks to say that things have been started, and there are green ticks when they've been completed. Now, the markers don't update in real time. The way Axia has set up the whole of their portfolio is the data is stored in data warehouses. Every 5 minutes, the system updates itself so that the data can be gathered remarkably rapidly. But it does this every 5 minutes. So if something's being completed, it will be 5 minutes before that changes. When you know about it, it's fairly straightforward. The other thing is you get warned about the system timing out. Anybody who's worked with the foundation training, current foundation training portfolio will know that you can get logged out and not realize you've been logged out and all your work is lost. So this warns you, tells you, and renews it 35 minutes each time you change a page. So does that answer that question? I hope so.
Thanks, Peter. Next question. So is the role of the team member linked to the DCT portfolio to get patients to do the questionnaire?
Just to get patients to do the questionnaire, yes. I mean, it could even be the trainee themselves, if they feel up to that. They could have a tablet there and they could have a separate login as a guest member, because literally all that team members login does is just brings up a new patient questionnaire. Somebody completes it, signs it, saves it, and then it's completed. So you might find yourself in a hospital clinic situation where it has to be the trainee who says, right, would you complete this, and gives that to the patient.
Okay, next question. How are concerns highlighted in the MSF?
Sorry, could you say that again?
How are concerns highlighted in the MSF?
All of the comments are published in the MSF. So if somebody does have concerns, we can see those. Let me go back to, let's log in to somebody else.
I think maybe the question is about the rating. So if someone's rated someone quite low, is that?
Yes, let's go to the heat map. Let's go to the heat map and just have a little look. Let's look at a lane, because I'll show you a DFT one because this is identical. There we are. So you can see here in the heat map, this is high ratings and this is low ratings. And you can see here the numbers of people who've actually put the scores there. And you can see the comments here, because there might be areas the trainee can do well, areas the trainee could improve upon. So we'll see things like that quite easily in the MSF. Does that help? Does that answer the question?
I think so. Thank you. We've got a couple more questions and then we can move on again. So is it right that the notes are private? A reflection that a trainee wishes to keep private could therefore be written as a note.
Sorry. Yes, the trainees don't have the notes function. It's the ES and the TPD. Mm-hmm. We could possibly extend it to the trainees. I don't know if that would be helpful. It's something which could be considered, and I could possibly action that.
But we will take feedback throughout the training year as well. So this will be a continuously improving product.
Yes.
Next question. Does each section of the portfolio load quicker than TURAS? I think just generally a question about the speed of the system.
Yes, it loads considerably more quickly than TURAS. Sometimes I've had a cup of tea whilst waiting for a TURAS page to load. I mean, yes, you can see here. It's quite a lot of work going on in the background at Axia today. But as I say, the pages load really quite rapidly. If we go to there we are, core training. Let's go to Susan White's page again. And again, we've reached her dashboard. And just click on that. The pages load literally just like that. So that is 1,000 times more rapid than TURAS.
Excellent. Okay, one last question before I hand back over to you, Peter. If you are a TPD and an ES, will you have 2 logins?
Yes, you'll have 2 logins. You'll have one login, which will be your GDC or GMC number, and the second login will be your GDC number with a suffix. Probably if you're an ES, that will be just your GDC number, and then the training program director login will be your GDC number with a capital T after it. And you might have 2 or 3 logins, because you might have a panel member login. If you're a training program director, you might be sitting on an FRCP panel as well. So yes, you'll have separate logins, and we've made the protocol that will have a suffix after your less commonly used GDC number. Yes.
Great, thank you. Okay, back to you, Peter.
Okay, right, let's just unlog from there. Personal development plan, again, I won't spend a lot of time on this. It's started and added to by the DCT. It's entirely the DCT. So they'll go there, they'll click on add a personal development plan. It's been set up so it copies the formula or the template for the GDC development plan. So they have the boxes which they can fill in and complete. And then it appears, here we are, like that. Now, the plans, personal development plan, and also the CPD log are what we call global. They appear in all of the portfolios. And so if somebody is doing one of the 2-year GPT schemes where they're doing dental foundation training and dental core training at the same time, they can have a plan for each of those parts of the portfolio, and they'll be able to see them in both. And your CPD log will carry on through. If you started that in your foundation training year, that same CPD log will carry on through to your DCT portfolio. So they are global actions. And again, to say the CPT log, you just set it off with the year in question. And it follows the GDC template. Something else I want to talk about is the learning needs. Now, this is something which is totally new for dental core training. We've put in a learning and development needs tool, which we've found incredibly useful in foundation training. And it appears on the dashboard, and you'll be able to see the high priority, the medium priority, and the low priority learning needs highlighted, how they've been addressed. And when you click on them and go to the list, you can see there, these are still incomplete. That one's been achieved, or the trainee thinks they've achieved it, but the ES hasn't said that it is complete. So the ES has to moderate it. The learning need itself is interesting. Every single assessment, every single form has a button at the bottom which says add a learning or development need. So if after the MSF has been produced, you can see as ES that there's something which needs to be developed, you can start a learning need. One word of warning, our user group has discovered that if you press on the learning needs button when you're halfway through completing the form, you lose everything on the form. So you save the form first and then start a learning needs. And it's like this, you need to put a name for the learning need so that you can see what it is on the list. It will automatically identify where it comes from, and I'll show you that when we log in again. Learning objectives, and it's not the feedback, it's the learning objectives and then how the objectives will be addressed. And then you have to put in a date by when you want it addressed and the priority of it, whether it's low, medium or high priority. And I think priority is not days, priority is the importance of it. And as I say, anybody can add a learning need. Trainee, educational supervisor, training program director, even a dean can add a learning need if they feel that there is one there. And I'm going to log into the ePortfolio just for a moment, and I'll show you some of the subtlety of what's gone on within the portfolio. Because if we go to this portfolio, where there's quite a lot of learning needs have been done already. There we are. We'll click on the list of learning needs. You can see there's 2 out of 3 done, and there we are. So there's the list itself. So if we click on this one, Invisalign problems, and that's come from a reflection. And we can click on that link, and it'll take us straight back to the reflection which produced that learning need. So you can see what the evidence is for that learning need, and you can see there the list of learning needs which have been brought up from that particular form. So we've got a huge amount of cross-linking throughout the whole of the portfolio. Supervised learning events. They've got all the ones which we have in TURAS, and as I say, assessor invited, but we've added some extra ones, simulation, DOPS, and a remote KEGS, and they've been added because of the pandemic and this need to carry on and do things remotely. And again, it's as happens with the TIRAS log, the trainee starts off completing things. This is for a remote KEX, so they can say the setting and mode of the encounter, purpose of the encounter, and then they send it to the assessor, gives feedback on introduction, etc. Then general feedback, and then they can send it back to the trainee for reflection. Here are the curriculum links, which the trainee will have added. It links to particular areas of curriculum. There we are. And the curriculum log, and this again is in the form of a heat map, so you can see how the trainee is covering the areas of the curriculum. And you can drill down on each of these. I can click on that and it'll tell me exactly which developing the clinical teacher forms have talked about professionalism, and we could go and see those. And if it's unaddressed, the area will stay pink. So you can see there the areas in curriculum which need to be addressed. And again, you can add learning needs to that. So I think that's really all of the new areas and all of the important areas covered. So are there any further questions at all?
Yes, we have one question. Am I right thinking that it is the TPD rather than the ES who publishes the MSF?
Yes.
Available to both mid and end term appraisal.
Sorry, I missed the last bit, Kat, sorry.
Okay, so let's start with the first part of the question. Is it the TPD rather than the ES?
Yes, it's the TPD rather than the ES, because the ES might be one of the people who provides feedback in the MSF.
Okay, and then the second part of the question, is this available to both on mid and end term appraisal?
Yes, it's available to anybody, yes. So you can, yeah, it's flexible. Have I misunderstood that question?
No, I think it's a timing question, and the idea is it can be run whenever.
You can run it whenever you wish to, and as often as you wish to.
Okay, those are all of the questions we have for now.
Right, do we have...
There have been a few questions about logistics, and you will hear from your local leads. I think Peter mentioned earlier that accounts are being created as we speak, and Peter has been in close contact with local administrators to get all of that set up. So anyone who needs an account will start to have accounts created shortly. Is that right, Peter?
Yes, that's right. I mean, it is literally today, at the start of today, none of the administrators had no accounts. I just checked just before we started this webinar, and we've got all of the administrators now linked in. They've got their logins sent out to them, and TPDs, I hope you might have been sent logins today. You were scheduled to be receiving them today or early tomorrow. So that should be happening now. Yes. And then it's just for the local administrators to upload the lists of educational supervisors and trainees, and that's not a difficult issue, I think.
Great. And we've just had another question about, or sort of another comment about the MSF, that
yes,
usually the trainee cannot see the report before it is published, and that is absolutely the case here as well. The trainee can't see any of the information until it's essentially moderated by the TP.
Yeah, they can't see it at all, and it's the same with the patient satisfaction questionnaire and the MSF. They can see nothing until it's been moderated, and if there's something particularly toxic, this certainly happens within dental foundation training sometimes. If there's something particularly toxic, the training program director can decide not to publish that comment.
Great. Well, we don't have any other pending questions at the moment. Is there anything that anyone would like to see in the system that Peter hasn't shown yet, or anything that anyone would like to see again?
Very happy to go back to things. It is new, it is different, but all of the people who've user tested it have said it's remarkably easy to use and it is remarkably intuitive. as Kat has said, I'm sure we're going to have some issues. We'll do our very best to update them as rapidly as we can. Axia are incredibly helpful. Our user groups have fed back some problems and they're being dealt with at the moment. But as I say, we're moving forwards, and the fact that the portfolios remain the same as the trainee moves through their training program, I think will produce a huge number of benefits, because they'll be comfortable with the system and they'll know how it works. So has anything more turned up, Kata?
No, we don't have any more questions.
Right.
So we can probably wrap up there then. So thank you very much everyone for attending. As I said at the start of the webinar, we will make this recording available, as well as the recording that we did earlier today that focused on dental foundation training part of the portfolio. So you will all be able to access both of those webinars, and we will make further materials available in the next couple of months as well. So thank you very much for attending. All the best for the start of the new training year, and please do contact your local leads, your local business managers, your local lead deans if need be, if you've got any questions, if you've got any issues, if you can foresee any challenges. We are really open to feedback. We want to make the system as good as we can. We want to make sure that it works for you. So please do send your feedback and we will work through it and do what we can. Thank you very much.
Yes, thank you. I'll echo those comments from Kata. Please send in feedback. We'll try and make it work. And good luck for next year. I hope things go really well. So thank you.